Welcome back, and we'll be doing Frontline shortly, but head of our health desk, Fred Smith, has just joined me in studio, and we'll be talking about the very latest, Fred, as far as our COVID-19 cases are concerned.
Well, Gifty, in the last few minutes, there's been an update on the Ghana Health Service website I'd like to give to our viewers. Cases have gone up from 566 to 636. That's the latest. And the update. So
you can go online or to the Ghana Health Service
the COVID page.
Website, exactly. Yes. I beg your pardon. And then we can bring it up for our viewers to see. But Fred, you were adding more, 636 right now.
Indeed, from 566. And if you check the details, an update on the recoveries has now reflected on the website. 17 persons have recovered. There are 241 who are well or responding to treatment. Only 2 are critically ill, and 8 persons have died. You know, there was some slip during the press conference that 10 had died. The clarification was made there, but now it's reflected on the website. And so if there was anyone who just heard the first and did not hear the clarification, here it is. The confirmation is that the deaths are still 8. And of the persons who were in mandatory quarantine in Accra, 105 in all. None of them has recovered yet, but we have all of them doing very well under treatment, and some of them are also responding very well. Then you talk about those who are under mandatory quarantine in Tamale. 10 of them. Well, they've always explained and accepted that one of them has left the camp, has escaped, but they continue to put 10 here. The records don't reflect the fact that one person is on the run. Right. So we know it, so we'll say it. So they got 10 confirmed cases in Tamale. One of them has escaped from isolation, and so they have 9 there. So if they say 10 are well and responding to treatment, we take it that 9 because we don't know what the other person is doing.
Other one, right.
Indeed. So the enhanced contact tracing, they've had 253 cases confirmed so far. None of them recovered so far, but we have all 253 doing very well, or at least responding to treatment, which is very encouraging for us. It means the explanation, I spoke to Dr. Kaba today, who's Ghana's, the leader of Ghana's testing team, and his explanation is that for those who are asking for ventilators, we may not need it if we're doing the testing ahead of the disease showing symptoms in people. And so before the symptoms show, you would have already identified the person and already put them on treatment.
I.e. before it gets worse.
Then, yes, then you bring it under control before it gets to the stage where you go under the ventilator. Because the thing is, majority of those who go under the ventilator don't eventually survive. They end up dying. Because
at this point, the situation has aggravated.
Indeed.
And the person's health is deteriorating pretty fast.
Indeed. Okay, so it's refreshing to note that a lot of the persons we have here are doing well or responding to treatment. Okay. And the statistics with regards to what percentage is community spread, that has also gone up. It used to be 66.6%. It's gone up to 70%. Persons who have no history of travel at all but have contracted coronavirus in Ghana. Then you have those with history of travel, just 30% among the 600.
And Fred, this was something that health personnel were really afraid of happening, community transmissions.
Indeed.
Initially, our very first case was imported, and every other case that came after it were imported, and people were really hoping that it wouldn't get to the level where there is community spread. But it has overtaken the imported cases, because we've even stopped people from coming in anyway.
And that's understandable, because we started the process of enhanced contact tracing, because these persons who brought in the virus from abroad would have interacted with other people and may have also spread it to them. So at this stage, these persons would have also spread it to other persons, and that's why the contact tracing became necessary. Now that we are doing it aggressively, we are beginning to get almost everybody who has come into contact or has been exposed to this disease. So it's great that we're having the numbers right now, and if we continue this way, I'm sure not too long we will have the cases going down. And then in terms of the regional breakdown, Accra has now gone to 509. The Eastern region, 41. You remember at the weekend, some more persons were being tested. Their cases stood at, as at yesterday, 32. Now it's gone up to 41. The Volta region still is at 9. The Ashanti region is at 53. It used to be 40 something. Then Central region is still 1. The Western region 1. The Northern region, they put 10 here, but I see 9. Of
course, we know. Oh, right. I mean, this is what's put together.
Yes, for all the cases here, indeed. The Upper East region 4. That hasn't changed. Northeast is 1, and then the Upper West region 7. That has gone up. It used to be 4. Okay, yeah, well, it used to be 7. So the cases are coming from Eastern, Greater Accra, and Ashanti.
All right. Okay. Well, so Fred Smith is head of our health desk, bringing us the latest numbers. The numbers have just changed this afternoon, and so he brought us that update. If you check on the, well, for me is on the right at the moment, but I'm not sure where you see it, but it is on your screen. It's in the corner of your screen. You get to see the figures as they have changed. We were 566 as of today, but right now we've increased the number of COVID-19 cases for Ghana have increased to, or has increased from 566 to 636. 8 people have died so far. 2 persons were told are in critical condition. And Fred, we heard that 2 people are in critical condition. Is this the same number, or are these the same people we've been referring to all along, or have there been any changes? No,
there's not been any change so far. The 2 are the ones we've always known to be in critical condition. The fact that they're still under the treatment means that things can get better for them in the course of time. So let's pray. We'll pray with them.
Right. And so just so you know, like I said earlier when I started the show, a glimpse of light there. 17 people have fully recovered, and we're told, Fred, that they tested negative consecutively twice.
Yeah, the idea behind the double confirmation is to prevent a situation where at the peak of the China crisis, we heard that some people who had recovered had relapsed and were now testing positive. It probably was that the person was not fully cured, and so the first test may have given you wrong results, which is very possible in the science terms. Then the second testing was not done, and so you will not get a confirmation of that. So what we at Ghana is doing is to have you test for the first time. So it means that if you go into isolation today, it will take another 14 days, then a test is done to see what your situation is. Then when that test is done and you test negative, you're on the way to recovery. That's where they'll say you're doing well or doing very well under treatment. Then another 14 days after that, you go for another test, which will show that you are negative. So you must have double negative to be cleared. If on the second test you show positive, then it means that they will bring you back to isolation and continue the treatment, which means that you have another 1 month to do 14 days and have a test, another 14 days and have a test. So in Ghana, you must spend at least a month to be certified as someone who's fully recovered.
These are no ordinary times, very difficult process. And that is why you should stay at home, because the more you stay at home, the lesser the chances are that you will get the disease, the lesser the chances are that if you have it, you give it to somebody. Let's stay at home. Let's stay at home. Fred, thank you very much for these updates. Certainly, as and when Fred has anything, he'll bring it to us. He's the head of our health desk who's been following this story from day one, going into all of the corners that there is information to give us. So we certainly will be updated here on the pulse.